on telehealth, telemedicine. The fact that we heard so many times the health minister talking about this alternative during the pandemic, and that people had to contact their doctor, and they had this possibility of having healthcare through the distance, and it was well done, and they had to use this option. Well, what was your reaction when you realized that there was no framework to do it?
Well, when we talk about telehealth, we think about telephone, but also visual. And what we found is that 99% of the telehealth was by phone. And it took 1 year to M3S to put in place a framework that would provide the physician to help them to establish if it's the phone or if a visual or in-person meeting was necessary. So yes, it was necessary to put it in place in 2020 because the law didn't allow the physician to do a consultation by phone. So only with the decree, they were allowed to do teleconsultation by phone. So it was necessary. But what we say is that they needed a framework. And we saw that for some physicians, more than 90% of their consultation were in telehealth, and 99% were in phone. So,
what's the problem with the phone for you?
Oh, because what INES and other organizations say is that phone is good for example, when you need to renew your prescription, or if you need a follow-up from when you get from the hospital. So that's okay to be by phone, but sometimes you need to have a visual meeting with your patient and or a physical meeting with your patient. So there are some issues to be by phone, but sometimes it's what it needs. But actually, the law, without the decree, doesn't allow the physician to be paid to be by phone with their patient.
Unless there is a public health emergency.
Exactly.
Okay. So your recommendation is to make sure that this framework for telehealth exists, it's put in place, and developed. And
they have to look at also the remuneration of the physicians, because they haven't took it they didn't consider it. So the physician is still paid the same thing than if he would see the patient in person. So maybe it's faster, maybe it's not faster, but the minister should look at the remuneration of the physician.